Are you finding that your consultation is going far too long? This is a common struggle among GB trainees. Hi, my name is Dr. Erwin Kwun. I'm on a mission to help doctors lead a fulfilling life. In this video, I'm going to share with you common pitfalls that lead to poor time management and how you can compress your consultation within 12 minutes. Poor time management is a symptom. It's important that we identify the cause of the symptom. What are the causes of poor time management? First thing is disorganized consultation. There's no structure in the consultation. This leads to the consultation being very chaotic, and it's very difficult to then consult effectively when your consultation does not have a good structure. The second cause of poor time management is poor listening. If a GP trainee is not listening actively to a patient, then it's going to be more difficult to progress the consultation. What's likely to happen is that the GB trainee might ask questions and repeat themselves and ask a question again because they haven't registered what the patient have said. So it's important that you give your patient your undivided attention and listen actively to what they've got to say. Reason number 3 for poor time management is lack of priming. If you're not priming your case adequately in that 3 minutes reading time that you're allocated, it's going to affect the quality of your consultation. What I mean by priming is utilize information that you're given in the case briefing and the case record. Think about whether it's relevant to the symptom that the patient might present or the problem that you might need to manage. So think about the differential diagnosis. Think about what are the red flags you need to ask for that consultation. Anticipate what might come from the consultation and whether you might need to discuss sleep apnea or you might need to discuss lifestyle changes. You might need to consider giving advice about driving. When you're playing it out in your mind, then it's going to be more smooth when you're in the consultation because it's not the first time you're thinking it through. So priming your case is very important, and you need to practice how you're priming your case so that you get better at that skill. Reason number 4 is not keeping track of your time. Keep track of your time, otherwise it's going to be difficult to manage a consultation within 12 minutes. If you can't measure where you're at in the consultation, then how can you expect to complete it within 12 minutes? Last but not least is procrastinating clinical management. This is a common phenomenon I've observed among GP trainees who dwell in data gathering and don't commit to working diagnosis. So they're procrastinating the clinical management, and then at 8-9 minutes, they realize that they've spent so much time in data gathering that they try to squeeze everything in clinical management within 3 or 4 minutes. So that's not going to work very well if you want to score well for the exam. It's important that you commit to working diagnosis and you progress the consultation. So what you want to do is that in data gathering, you want to ask questions that's going to progress the consultation. There are so many questions that you could ask, but be selective as in what questions that you're going to ask. So ask pointed questions to move the consultation forward. Otherwise, you're going to be circling around and dwelling in data gathering. And then you won't be able to come down to working diagnosis because your questions have not helped you to distinguish what's the cause of this, and you don't have enough information. So really important that you progress your consultation and commit to that working diagnosis and move on to the clinical management. By now, I hope you have an idea what are the causes of poor time management in your consultation. If the problem is due to a lack of structure, not very organized, then you might benefit from going back to revisit some of the consultation models and the framework. So I would recommend that you write down your consultation structure. In the back of your mind, you have a framework so that you know how to progress your consultation and you're systematic in your approach when you're eliciting the story. If you're not systematic, you're going back and forth, it's going to take you longer to take a good history. If the problem is that your pace is slow, then you might need to increase your pace. The way I would suggest you can do that is compel yourself to consult within 10 minutes as a challenge. By doing that, you will have to increase your pace. And then when you go back to 12 minutes, you'll find that it's not as hard to consult within 12 minutes. This tip has really helped a lot of GP trainees I've worked with. So try it out and let me know how it goes. Have you found the insights in this video useful so far? If so, you might be interested in essay blueprint and mini course. This is a free blueprint that you can get and teaching from myself. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. If you find that the problem is that you're not listening actively to your patient, then you need to practice active listening. Listening is not a passive activity. Great listeners choose to listen. When you choose to listen, you choose to give your undivided attention to your patient, then you're going to listen with an open mind. If it's so busy in your mind, you're thinking about what other question you might ask, then you're not going to be actively listening to what the patient is telling you. One bonus tip to keep your consultation within 12 minutes is to avoid over-explaining. A lot of registrars think that when they're explaining in detail and they're telling the patient so many things, that it's a good thing for their clinical management. However, some patients might not even be interested in that explanation, or they already know some of the things that you're telling them. So when you're explaining, it's important that you tailor your explanation based on the patient's need and what they want to know. So keep your explanation simple. Many registrars tend to over-explain and have long-winded explanation. And what happens is that they're lecturing the patient about the condition, when what you need to do is have a dialogue with your patient, ask them a few things, and then explain in 3 to 5 chunks, and then check where they're at, and then progress the consultation. So it's important that you have that dialogue, ask the patient whether there's anything that needs to be clarified, they haven't understood, and then move the consultation forward. If you found this video useful, you might want to watch the next video in which I interviewed Roger Neighbor. We talk about remote consultation, and it's going to help you for your preparation. Take care, everybody. Bye-bye.